Now, there's also a tendency for individuals with autism to do better on explicit tasks. And what this, again, gets into is that I can tell you the right thing for the social situation. I just may not perform that if I'm a person with autism. And again, that's a very complex thing for us when it comes to teaching someone with autism, because we look at what they're doing and we think, they've told me before that they understand the rule. They've told me before that they understand that they should be quiet. And yet, right now they're talking in class. Why is that? And that's because there can be a distance. For some individuals, there can be this distance between, again, what I'm thinking and how my thinking modifies my behavior. And then there may be a preference for peripheral rather than direct eye gaze. And this can be very complex when we're trying to figure out, is somebody paying attention to what we're saying? And so we need to look for cues, and we need to actually check for comprehension to make sure that an individual is actually understanding what's being said. Now, one area of social cognition is really around emotion. And when we think about emotion, we're really looking at, for some people, having difficulties both with the expression of emotion as well as the understanding of others' emotion. For a moment, we're going to talk about the expression of emotion, and what we may see is an underexpression or a atypical expression of certain emotions. So they may not smile when they're happy. Some individuals will be quite sad but have a very neutral face. Some individuals with autism will have a very sad, resting face, and yet they're pretty neutral in the emotion. So there may be some underexpression of the actual emotion that's being felt. Now, there's also some atypical expression of emotion, as we were saying, and this may be, like smiling when upset, or they may laugh when they feel embarrassed. And again, this may be something that's difficult for us to read because it's out of sync with how we would generally interpret that emotion. Now, they might also have difficulty regulation of emotion, and something might get big very fast for some people. And it's really important to keep this in mind because this can be at times how something seems to come out of the blue at us. It's because they have, some individuals with autism will have difficulties with emotion regulation. And quickly, a very small thing can become a very big thing. So there may be some need to teach the person some emotion regulation skills. Now, emotion may also be poorly modulated by thought. And we tend to think about our emotions, and at times we can even use thinking to get ourselves out of a particular way of feeling. Many individuals with autism have difficulty actually using their thinking actively. And again, this is another area where they can be taught to use their thinking to really modify or modulate their emotions. Now, some individuals will actually freeze when they experience intense emotion. And in that freezing, they may, again, be experiencing quite intense emotions internally while showing nothing on the outside. Now, they may also have difficulty reading others, and in fact, this is pretty classic for many people with autism. And again, reading emotion in others is really a complex task because there's so much we have to take into account. Their face, what they're saying, how they're saying it, their body language, how their bodies turn to us, how their body's actually moving, which we call biologic motion. These are all things that we use to interpret emotion in others. And that can be quite a challenge for some people with autism. And I look at biologic motion, and my example of this is I can see my wife walking toward me across the store. I can already tell what her emotion is just in how I see her body and how it's moving toward me. So I can tell if she's upset with me. I can tell whether she's just relaxed or happy just by how her body moves. That can be quite a challenge for some people with autism. And there's also face perception, and face perception starts to get into really the concept of how do I read more fine-tuned emotions. So I may be able to read a broad emotion by body language and by kind of that biologic motion, but I really use the face and particularly the eyes to interpret the more fine-tuned emotions. So embarrassment, disgust. These are things that really I need to begin to use what is the facial mask, which is around the eyes. And what studies have shown for some people is that they tend to use more the object center of their brain, or how we process objects, rather than how we process facial features. And processing facial features is something that our brain is really, the neurotypical brain is really designed to do very quickly, very efficiently. And for the person with autism, it can be much less efficient. Even if they can figure it out, it's done slower with a much less efficient system. They may also gaze away from the face. They may have a focus on other parts of the body or on other objects throughout the room, rather than really utilizing the face. And some people will actually say that making eye contact is painful for them. And you know, when I've really looked at this, I guess the interpretation that probably works best for me is that the face really is changing very, very quickly. It's very confusing. The eyes and the mouth and just the whole facial structure is really constantly moving during social interaction. And in fact, the author and the psychologist Paul Ekman has studied it and said that we are making movements in fractions of a second in our face as we're experiencing emotion. And particularly as we're doing other things like talking, the face is moving so much that can be very challenging to really look at. And for the person with autism who struggles with facial perception, this may just be too much. Now we're going to shift into looking at academic skills. And as we look at academic skills, again, the skills that are needed for the lower grades, particularly through elementary school and partially into middle school, are really rote skills. They're very much learning the procedures of learning. So we learn to decode words. We learn to do basic computation. These are things that really underlie the development of more complex skills, but they're fairly rote skills. As we get into the higher grades, so upper middle school and then into high school, then we make the shift into more abstract or conceptual skills. So now we have to summarize and we have to interpret. We have to use these complex mathematical equations. So now no longer are we using necessarily a number, but now we may substitute a letter for that number. We may also substitute symbols like parentheses for certain mathematical concepts like multiplication. There may also be some difficulty with switching from those skills earlier in school to later in school. And it may not just be that the individual has difficulty making abstractions. They may also have difficulty with that actual movement from how they were learning in earlier school to how they're learning in upper, middle, and high school. Because those actual tasks of learning may be different. And then, again, it is, I think, important to be aware that in lower skill or in lower grades, they may function, in fact, they may do absolutely as well as their peers in classes, and we may start to see them slowly fall behind. And so it's really due to the factors that we've already talked about, but sometimes this can cause a great deal of concern because we think we're seeing decline, or we think we're seeing somebody who's actually losing skill, when what may be happening is that they may not be getting what is currently being asked of them.